stands for the human papillomavirus, and it's a common virus that can cause a variety of health problems, including some types of cancer. But did you know there's a vaccine you can take to help protect yourself from HPV and its related illnesses? Too many women are missing out on the HPV vaccine and cervical screening. Did you know that cervical cancer is one of the top 5 cancers that affects women in the world? The HPV vaccine has been shown to be up to 99% effective at preventing HPV-related cancers. And cervical screening, sometimes known as a pap smear or a smear test, can also pick up on HPV infection early on and help prevent cancer. My name is Dr. Anne, and I'm going to go through everything you need to know about HPV and the HPV vaccine. HPV is a virus that affects both men and women, and it primarily spreads from sexual contact. There are around 150 different strains of HPV. Most strains cause no problems, but there are high-risk strains, which is why you need the vaccine. HPV is one of the main causes of cervical, vaginal, anal, vulva, penile and throat cancer. So what is the HPV vaccine? Well, the HPV vaccine is a vaccine that prevents infection with certain strains of human papillomavirus. There are currently 3 different types of vaccine which are commonly used, and I'll go through them in this video. How does the HPV vaccine work? Well, the HPV vaccine works by helping your body recognize the virus by giving it small amounts of the virus's proteins, which triggers an immune response. This means that when your body comes into contact with this virus later on, it knows how to better protect itself. Why is it important to get vaccinated? Getting vaccinated against HPV is important for a number of reasons. The first reason, depending on the type of vaccine, it can help prevent you against genital warts or other related conditions from HPV. Number 2, it can reduce the risk of certain types of cancer, including cervical, anal, oropharyngeal cancers. And the third reason, getting vaccinated helps protect other people in your community and limit the spread of HPV. The most common questions people ask is the HPV vaccine safe? Yes, the HPV vaccine is considered safe and has undergone rigorous testing from worldwide organizations. Like all vaccines, the HPV vaccine can have side effects, but these are generally mild and go away on their own. What are the side effects of the HPV vaccine? Well, the most common side effects of the HPV vaccine are pain, redness and swelling at the injection site, but other possible side effects include fever, headache and nausea. These side effects are generally mild and go away on their own within a couple of days. How many doses of the HPV vaccine do I need? The number of shots of the vaccine you need depends on the age at which you got the vaccine first, usually. On this table, you can see the common schedules. So generally between the ages of 9 and 14, it's given as a 2-dose series. And between the ages of 15 and 45, it's usually given as a 3-dose series. How is the HPV vaccine given? The HPV vaccine is given as a series of injections into the muscles of your upper arm or your thigh. Can I get the HPV vaccine if I'm already sexually active? Yes, individuals who are already sexually active can still benefit from the HPV vaccine. This vaccine helps protect you against strains of the virus you have not yet been exposed to. But remember, the vaccine is most effective before you're sexually active and exposed to the human papillomavirus. Can the HPV vaccine prevent cervical cancer? Yes, the HPV vaccine can help prevent certain types of cancer caused by HPV. And the HPV vaccine is highly effective at preventing HPV infections that are related to the majority of cervical cancers. The vaccine also helps protect you against other HPV-related cancers such as anal, vaginal, vulval, and oropharyngeal cancers. It's important to remember that it doesn't protect you against all types of cancers related to HPV, and that's why it's important to see a doctor if you have symptoms. So my top tip is to make sure you attend regular screening, and that's because we want to pick up these infections and their problems early on. Why is the HPV vaccine given in men? Well, the HPV vaccine is recommended both men and female because both sexes can have HPV-related health problems. In men, HPV can still cause genital warts and lead to some types of cancer, including penile and oropharyngeal cancers. So my top tip is still to get vaccinated if you're a man, as you can help prevent yourself getting genital warts and some types of cancers related to HPV. There are more than 150 types of HPV, and we know them as numbers. There are 14 high-risk ones, including numbers 16 and 18, which are one of the main causes behind most cancers. So which HPV vaccine is best? Well, there are 3 commonly used ones at the moment, and all 3 vaccines are effective in preventing HPV infections and some types of cancers. The choice of which HPV vaccine to use will depend on factors such as age, sex, your vaccination history, and what is recommended in your area. In general, the CDC is currently recommending Gardasil 9 as the preferred HPV vaccine. In this image, you can see which vaccines protect you against which strains of HPV. Strains 16 and 18 protect you against common related cancers such as cervical cancer, and protection against 6 and 11 protects you against genital warts. What's the difference between Gardasil and Gardasil 9? Well, they both protect you against 4 types of HPV that causes the majority of cervical cancers, as well as genital warts. But Gardasil 9 protects you against 9 types of HPV, including 4 types covered by Gardasil and an additional 5 types. Cervarix protects you against 2 types of HPV that cause the majority of cervical cancers. So how long does the vaccine protection last? The HPV vaccine offers long-lasting protection against HPV infections, and researchers have followed people for up to 12 years, and it's showing good levels of protection. So in summary, the HPV vaccine is an important tool protecting you against HPV. So my top tips are: get vaccinated, it helps prevent you against genital warts and other types of related cancers to HPV. If you're nervous about HPV or its side effects, speak to your healthcare provider and they can help reassure you. Number 3, make sure you attend regular screening to pick up on problems early on. Number 4, if you do have symptoms or you are worried about something, speak to a doctor so we can help support you. Thank you for watching, and I hope you found it informative.